back pain, knee pain, neck pain, or lower back pain, your body is signaling that something is off. When you trust a professional, your body thanks you. This is all about Dr. Cooch. We asked him all the questions we were interested in, and now we are ready to share all this information with you.
My name is Dr. Jay Cooch. I'm an interventional spine specialist here at Total Orthopedics, both in New Jersey and New York. So today I'm here to talk to you a little bit about what I do as an interventional spine specialist here at Total Orthopedics and what we do have to offer you as a patient to get you better using conservative care and help you out with your pain.
So, Dr. Cooch, can you tell us what is an interventional spine specialist and how is your approach to treating pain different?
Sure. So as an interventional spine specialist, as the name implies, I do use interventional procedures to target areas to reduce pain. And we do this using typically epidural steroid injections to target an area to control swelling or inflammation after an injury. This is just one part of the treatment. When an individual comes in to see me, a full evaluation looks at more than just what the pain generator is. So I don't label myself as a pain specialist. I label myself as a spine specialist. And as part of that, a very valuable component is to identify biomechanical issues that have started because of the pain or have been part of creating the problem to begin with. So even from the initial evaluation, I'm starting to think about an individual's activities of daily living, their functioning, and seeing what type of activities or exercise are their goals. So my goals are the patient's goals.
So, doctor, can you actually treat chronic pain issues without medication?
Sure. I do think that there is a role for using medications, not to mask pain, but to reduce some of the causes of the pain, to expedite healing and recovery. But the patient is the most important part of the team. And they get to make decisions whether or not they go for surgery sometimes, for exercise, for medications. But we discuss the patient needs and their goals. And if reducing the use of any type of medications, whether by mouth or with injections, is part of their goal, then absolutely.
Doctor, do you have any experience yourself dealing with back pain that you've suffered, and what type of things have helped you along the way?
Yeah, so I you practiced spine care for 15 years. And during that time, I've been very active. I have an exercise physiology degree. I did biomechanics graduate work. But I've always been active in running, swimming, bicycling. And I actually tried to put these things all together and do an Atlantic City triathlon. Unfortunately, a woman that was late for work broke through the police barricades, and in her minivan, she and I met, and I suffered an injury to my spine. I herniated 2 discs out, and it had to go through the same process of healing and recovery that I've been providing my patients for 15 years. This was 10 years ago now. So during that time, I did do significant improvements. I had significant improvements with my pain and function, but I couldn't quite get back to that level of exercise that I wanted to. So for me, I ended up going for spine surgery, and I ended up having microdiscectomy at 2 levels, and this significantly helped the underlying problem. Part of this, though, because I did have pain and discomfort for over a year, I developed really unusual movement patterns. So getting back to my level of activities in sport were limited. I couldn't play soccer with my kids the way that I wanted to. So for me, I found yoga was one of the best strengthening and stretching components that lended well to me building up the endurance of the muscles that help support the spine so that I can do the things today pain-free.
So, doctor, how can diet reduce pain and inflammation in the patients that you treat?
I actually talk proper nutrition to all my patients. It's, kind of a difficult thing to call it a diet because it has a interesting connotation, but we all have a diet. And what your diet does for you as a healing person can be dramatic. Uh, there's a phrase, food is medicine, and I truly believe that. What you put in your mouth can really help increase or decrease inflammation. And when there's an injury, controlling inflammation is key. So I recommend to all my patients there's 4 things to try and avoid. One is sugar, two is processed food, three is alcohol, and the fourth one is the most difficult for a lot of patients, and that is cutting out meat and all dairy products. These have been shown in research over the years to increase inflammation through the gut. So, the best diet for any individual suffering from an injury is a whole food plant based diet.
Doctor, how can things like massage and acupuncture assist in the treatment of chronic pain issues?
Sure, they're a great component. Part of what we need to do when we're trying to get an individual back to their activities of daily living is see their movement patterns and give exercises to address those. So, having acupuncture or massage or chiropractic or even the injections that I perform can help control the pain, get the muscles to relax so that we can really even identify movement patterns to prescribe the proper exercise.
And doctor, what are the pros and cons that you see in the use of steroid injections for pain relief?
Great question. So, steroids are by far the best anti inflammatory known to man. They can be given 2 different ways. One is by mouth. The advantage of this is it works very quickly, but the disadvantage is it goes throughout your entire body and only part of it goes to the area where the problem is. The second option from a steroid standpoint is an injection. After we've gotten proper imaging and done the proper evaluation, targeting that area with an X-ray guided injection of steroid can significantly reduce inflammation. The advantage is just that. We're targeting an area to reduce the swelling. The disadvantage or risk is very similar to an injection of any sort, or even when you're drawing blood. You can have pain, bleeding, or bruising local to the site of the injection. These risks are increased because we're doing it obviously around the spine and there's nerves involved. This is the reason why we do everything under sterilized conditions, under a 3-dimensional fluoroscopy, so that the patient and I both know I'm putting it exactly where we want to.
Doctor, what are some of the biggest myths that you see about sciatica and also things like lower back pain radiating into the lower extremities?
Well, sciatica has been used quite a bit by patients for years and years and years. And identifying is it truly the sciatic nerve that's involved? We have several different nerves that come out of the lower back or into the arms that could be affected, and it's not always sciatica. The other question is it sciatica at all? Meaning, is that nerve component involved, or do they have another condition in the spine with the muscles or ligaments or these little hinge joints that we have in the spine that become arthritic or inflamed due to injuries like whiplash that are actually creating the back pain that refers discomfort into the gluteal area? It seems like to me, consistently in doing this long enough, patients that have back pain that goes into the gluteal area always say that this is sciatica, and it may or may not always be.
Doctor, how does stress and anxiety come into play when you're talking about pain management? And how can you do things to fix that?
Oh my gosh. Wow. So this is such a huge component, especially when we talk about, individuals that have been having pain and discomfort, and I'm one of them. If you suffer pain and discomfort after 6 weeks, let alone 6 months, really dramatic changes occur. And these things can significantly affect healing process. So after having a year and a half of conservative spine care, I was having issues. I found yoga to be one of the most beneficial things, not only for my conditioning, but also for my mental state, allowing for me to be able to reset the nervous system through my mind.
So, Dr. Cooch, what's one thing that you tell your patients not to do that you do yourself?
There's nothing. The same advice that I give my patients is what I give myself, what I give my mother, what I give any loved one or friend. So there's nothing that I'm going to ask of or not of a patient that I'm not willing to do myself.
So this is real talk. As an interventional spine specialist and as someone who advocates for the use of yoga, are you ever in public and actually judge someone else's posture?
Hmm. Unfortunately, yes, I do. It's part of me as a physician. I don't judge them and tell them, but I'm always looking at and seeing what devices are doing to our posture, and what are the things that they could potentially do to try and address problems before they become problems.
Are there any real patient questions that you get that actually keep you up at night?
I mean, the number one question I think is one that is very difficult to answer, which is, looking into a crystal ball. When am I going to get back to fill in the blank? So any individual that comes to see me, whether or not their goal is to be able to walk to the mailbox and uh, get out their mail, or to be able to get back to their professional sport, I can't look at a crystal ball and say, it's going to be 6 weeks or 6 months.